This is the injury report presented by NYU Langone Health. The Knicks were without OG Anunoby in Wednesday night's last-second controversial win down in Dallas. OG is expected to miss at least another week with a hamstring strain that he suffered this past Friday. Dr. Guillem Gonzalez-Lomas, who specializes in sports orthopedic surgery at NYU Langone, is on to break down what the training staff could be looking for when they reevaluate OG in about a week. Doc, scary finish last night. They did get the dub, but let's talk about OG because he left last Friday's win with that hamstring strain. So at the time we're taping this, he has a little over a week left before he's reevaluated. What's that process going to be like for him in terms of the recovery and the rehab during the 2 weeks that he's scheduled to miss?
Yeah, so hamstrings are really tough injuries. You got to think of this muscle. It spans two joints, the hip and the knee. So it attaches on your sit bone on the pelvis and then goes all the way down. It's basically three muscles. And then they go across the knee as well to attach onto the shin bone, the tibia. A lot of very complex biomechanics at play, long muscles, long tendons. And so that sets them up for injury. And where the injury is and how much of a tendon and how much of a muscle gets involved and how many muscles, right? Again, there's three of them. That really dictates what the rehab is going to look like. I would say that at a 2-week predicted return to play, you're looking at probably a more minor injury. Again, it's hard to know for sure, but that's probably involving just the muscle and not as much tendon. So I would say that given everything, it's not the worst news that you're looking at a closer to 2-week recovery for him.
OG being the utility player that he is, he can play on the perimeter, he can play in the paint. A lot of his game can be taxing to his body and because he's so physical and the pace that he plays at. So when they do reevaluate him, how do they know if that hamstring is actually like combat ready or game ready?
Yeah, and that's really, where the devil's in the details. So he's got a great training staff working with him. And what you're going to want to do is really just like with every muscle injury, you're going to want to titrate the stress on that. So initially, of course, you have a period of rest, let it calm down, and then you start stressing it. And actually, a lot of the more recent evidence is supporting getting to have that muscle be somewhat active. You always want to use pain as your guide. And so you want to stress it just to the point where it would be painful. What they'll start doing is go from concentrics, where the muscle is shortening under resistance, to doing some eccentric testing where the muscle is lengthening under resistance. If both of those are good and painless, they can then advance to doing some more explosive movements. And as long as he continues progressing in that order, once he's able to jump and do play that explosive game that he plays, then he's ready to go back.
So once he's able to do that and he's cleared to play, do they start him or does he come off the bench? Like, do they have to ease him back into the rotation is what I'm asking.
Yeah, I got you. And that's a great question. Look, I think this is where the training staff and the coaching staff and the player have to all be, kind of a similar mindset. Most of the time, what, the training staff will tell the coaching staff is, when we think the player's ready to go, they're ready to go. But of course, we know that during games, people exert themselves. These players exert themselves a lot more than, during rehab or practice even. So I think it's reasonable when someone's coming back from injury to again, ease them into it, maybe limit the minutes that they might have later on, make sure they tolerate the game well, and then you can progress from there. But again, this is where it's all about, case-by-case basis, training staff, coaching staff, player, they're all communicating, all kind of one mind, and that's where you get the best return to play outcomes.
Doc, you've got range. You could have patients that are pro athletes, and you can have patients with strained hamstrings that aren't pro athletes. So can those patients that aren't pro athletes, can they be as aggressive with their rehab as an OG Anunoby, or do you suggest something more conservative with their approach?
Well, I think you always want to be smart, use common sense, and using pain as a guide is always, a good plan. Like we discussed earlier, these hamstring injuries come in a lot of flavors, and a lot of times, if there's a lot of pain or a pop or something like that, you want to get that evaluated immediately, because that could be something more serious. If it's pain off of that sit bone where the tendon attaches on the pelvis, you want to get that evaluated immediately. Most of us are going to have these hamstring injuries sort of in the mid muscle belly, and most of them will be these strains. So really the same approach, initial period of rest, but I think it's a good idea to see someone, if it's not better in just a few days, have it evaluated, make sure that it's nothing more serious. And look, not all of us have training room, every single day that we can spend 2 to 3 hours at, but we certainly have professionals, healthcare professionals out there, physical therapists, that can work to help get us back sooner. So absolutely, it's the type of injury where you want to do work to get back, not just not do anything, because that's not good either. We don't want the muscle to atrophy. So some good physical therapy is typically what the doctor ordered for these injuries.
Some great information there, Doc. That's why you guys are the best in the business. Thank you for joining us today.
Absolutely. My pleasure.